Thank you for this opportunity to present work on perspectives on depopulation and low fertility in Eastern Ukraine. First, I'd like to mention that although we've had many presentations on Eastern Europe and various other rural areas throughout Europe in this conference, for the most part, the academic discourse on low fertility has been dominated by Southern Europe and East Asia, and far more attention within the academic literature has focused on Eastern Europe. Eastern Europe faces this triple burden: low fertility, high emigration, and relatively high mortality. Also, as has been pointed out, many of those facing this triple burden are the most deprived, facing accelerated aging and a shrinking labor force. So this presentation focuses on Ukraine, which has experienced perhaps the largest magnitude of population decline over the past, say, 20 years. Population peaked at 52 million in the late 90s. But we don't really know what happened subsequently because the last census was in 2001. And while there have been various estimates, for example, the World Bank estimate of 44.4 million, or the State Statistics Service of Ukraine, which was 41 million, they aren't necessarily based on data. In 2019, the Ukrainian government conducted what they called a digital census, compiling evidence from mobile phone registries and various other pension records, and they estimated 37.3 million people, but most demographers in Ukraine think that this is an underestimate. Also note that it did not include what is called the non-government controlled areas, which I'll talk about in a minute. So this triple burden has been increasing numbers of immigrants, life expectancy around 77 for females and 67 for males, and a total fertility rate of 1.3 in 2018. Also, Ukraine is the only low fertility country in the world to have experienced armed conflict on this scale. This started in 2013 with protests, which led to the ouster of their president. Then Putin annexed Crimea, and Russian-backed separatists took control of two regions, which collectively are called Donbass, in April 2014. About 13,000 people died during fighting. This also led to 1.7 million internally displaced persons in Ukraine. Some also went into Russia. This is the largest group of IDPs in Europe, and many of them lost homes. They had previously owned homes, and then they had to rent or try to find other means of housing. They also lost income and support networks. So really a decline in standard of living and support in general. Now, what was left behind is something that is officially called the non-governmental controlled areas, and they're really an unknown entity. They're not recognized by any official government in the world. They're controlled by Russian-backed separatists, and they're left in limbo with just a lot of unknowns. Over the past 7 or 8 years, there's been this deterioration in public services, health systems, transport. People talk about difficulties with passports, marriage documents, birth certificates, and all of this is making life very complicated. And then, of course, COVID has affected the region even further, with restrictions completely sealing off the area and very little movement across the border, which previously had been quite necessary for various support. A low-level conflict continues on the border, and every once in a while, Russia is seen as a threat. So we had the opportunity to conduct online focus groups in June of July in 2021, so relatively recently. The aim of focus groups is to better understand people's perspectives and opinions and to elicit social norms. It's different from in-depth interviews, which look at people's life histories or ask about personal opinions. The idea here is to gather general perceptions on a particular issue. I'd like to note that this was moderated by a Ukrainian survey agency, and online methods for collecting data through focus groups is relatively new, but it had the advantage of, first of all, the participants didn't need to go anywhere. They could talk in the comfort of their own home, but more importantly, we would not have been able to, and the Ukrainian survey agency would not have been able to go to the non-governmental controlled area. So we were able to collect data from a group which is cut off physically from the rest of the world, but is remarkably connected in terms of the internet. So our questionnaire guideline was developed for different groups: Ukrainian residents, IDPs, NGCA residents, and we divided them by men and women. And the discussions lasted for nearly 2 hours. So we had 4 different locations. Our kind of control group was Kharkiv, which was Ukraine's second largest city, which has about 1.5 million people. Then we had 4 focus groups in rural areas near the contact line. There are 4 in Mariupol, which is on the border of the contact line, a seaport, which is relatively large, but had been controlled by the separatists for a very short period. At least parts of it had been during the conflict, so very close to the conflict area. And then 4 in Donetsk, which is the large city in the NGCA, which is now depopulating due to this conflict. So we asked people, how do focus group participants, or these are the major research questions, how do focus group participants perceive population change occurring around them? How does this differ by region? How do they talk about depopulation in Ukraine as a whole? Do they know that the country is shrinking or deem it to be a problem? And what are the main reasons for low fertility? So what I'm going to present today are preliminary analyses, and it's just a snapshot of these very rich discussions, but I want to highlight a few major issues. So when we ask this question of how has the population of your area been changing in recent years, people didn't always know what to say. They sometimes had difficulties answering the question, or they refused to answer or give an opinion. They didn't think in terms of population numbers or counts. They would have talked about the characteristics of their local area. People had become angrier or more closed. They talked about seeing more alcoholics, IDPs, or military presence, all of which is not surprising, really. And it's important to remember that the conversations happened in July of last year, when the country had opened up a bit, but people's experiences would be influenced by previous COVID lockdowns and then summer weather. So in the government-controlled areas in the western parts of eastern Ukraine, discussions really reflected urban-rural migrant flows, and in particular whether areas were receiving areas for IDPs. So in Mariupol, they talked about this influx of IDPs, and some of them spoke very positively about this influx, noting that there were professionals, students, and specialists. Recently, they had seen an increase in mothers and children on the street, so very little perception of any sort of depopulation going on. In Kharkiv, which is a growing city, of course, they talked about more people, immigration of students, foreigners, some IDPs, but they didn't, of course, perceive any sort of decline. The rural areas near the contact line were more complex. Some saw a decline and mentioned how childcare centers had closed, but others noticed this influx of IDPs or thought that nothing had really changed. In the NGCA, on the other hand, it was quite different. There was noticeable population decline. People talked about many apartments in their apartment building which were empty, vacant, and they thought that the conditions had deteriorated. Although some of the people in the focus groups had left to go to Ukraine or Russia and then had returned, and so there was population movement that was noticeable. So some noticed more people on the streets recently, but mostly in comparison to the COVID restriction times or early in the years. And others did note that there had been an increase in fertility recently, because probably people had been postponing through the conflict years and currently felt a little bit more confident, at least economically. But of course, it depends on the region. So one focus group respondent said that those who live in the center of Donetsk see many people around them, but then on the outskirts, there's still shooting that's happening. And of course, there will be no children. So when we asked about Ukraine's shrinking population as a whole and whether or not it's a problem, again, many people hadn't heard about it. They couldn't answer the question or had no opinion. Most saw that national population decline was a problem. especially emigration that could result in labor market shortage. So they, of course, talked about people leaving Ukraine and a brain drain. And they discussed how people were having fewer children due to financial hardships and little state support. And we have another paper that is going to examine low fertility and economic, political, and social uncertainty in greater detail. So when they talked about the population problem, some said it's a huge problem. Young people have left in huge amounts. People have died in the Donbass conflict and in COVID. Using the word, this is a demographic pit. Plus, fertility is declining because there's not enough money for anything. Surely, if you have 2 children, or in many of the discussions, it was 1 child, you can't afford a 3rd one. And just briefly about the reasons for low fertility, they talked about how people had lost confidence due to these macro level events. So there will be a pandemic, a war, a conflict, there's no stability, people don't have confidence, therefore they don't have children. And another person said, the situation is very unstable in the entire country, so young people overall are kind of not wanting to give birth and they refuse.
There are 2 minutes left.
Thank you. So for IDPs in particular, their experience would have colored their desires for children. So one person said that for me, the situation in the country still raises fears. I don't know in general what to expect in the next few years and whether I do not need to have to flee somewhere again. But then again, if I have to flee with children, it would be more difficult to go somewhere in another country and settle in a new place. Everything is not so simple. So clearly, IDPs refer to their experiences when they were thinking about having children. Now, we also encountered some conspiracy theories, which I thought was rather relevant to many political discussions in various countries. So they talked about how this is how everything goes, how everything has always been. People die, war, virus. There are many other factors that provoke one not to give birth. Why is this taking place? We're all cockroaches. Those who are doing this, they're doing this on purpose. And the moderator asked, who does it? And the respondent said, I don't know, but somebody else said Americans. And there was a long discussion about this situation in a conspiratorial way in the discussion itself. So to conclude, it's important to acknowledge that these perceptions of population change are very local and depend on surroundings. We've seen this already in the discussions about rural and urban change. Here we saw, however, that there were some areas which we would have expected to be depopulating, which had received these IDPs, and so therefore were not experiencing such sharp population decline. But those people in the NGCA area felt that their region was dying out, and the discussions were really quite bleak about what would happen there. Although that said, some did notice local population booms, and if people did have connections to Russia or any sort of stable employment, then they might have been having children and taking advantage of various different situations, even in Donetsk. So most people thought population decline in Ukraine was a problem. They talked a lot about emigration, which was a threat to the labor market, even though they complained themselves about their own unemployment. And it's very clear from these discourses that macro level events such as the war and the pandemic have led young people to stop having children. At least that's how people are perceiving it. But growth in cities is still seen as a positive light, even if it means that people are moving from the rural areas. One thing to note is that Ukrainians in our focus groups did not talk about how they needed to have more children to save the nation. This might be quite different than in Russia, where there are far more discourses about trying to boost fertility as a duty or a responsibility. We heard very little about that in Ukraine. Most of the decisions were on the individual level, and people were having children if they could afford them or not. And then just also kind of remarkable was that there was very little discussion about Ukrainian Russian identity in any of these different areas, and very few people thought that the reason why people stayed in the NGCA was because they identified more as Russian or with this separatist political state. Now, this could be because of the nature of the focus groups, but in general, that was rather striking. People are focusing on their own individual situation, and our perception was that the Ukrainians in this whole situation were being treated as pawns by the governments that were leading to these conflicts. That's it. Thank you.